Hello and welcome to Wellbeing. I'm Graham Wilson. Today we're going to talk about measles, the most contagious infectious disease known to infect humans. Professor Joshua Davis is Senior Staff Specialist in Infectious Disease at Newcastle's John Hunter Hospital, and he's Deputy Director of the Hunter Medical Research Institute's Infection Research Program. Thanks for joining us today, Josh.
Yeah, hi, thanks for having me.
Can we look at the background first of all? We might assume everybody knows what measles is, but just explain what it is. What's the range of symptoms?
Yeah, sure. Measles is a viral illness. In the past, it was a common childhood illness. So those of us born before about the mid-1960s, most of those people will have had measles when they were young children, but those born since the mid-1960s haven't because of vaccination. And in most cases, it's a relatively mild illness causing flu-like symptoms, aches and pains, nausea, fatigue, and then followed by fever and a rash that starts on the face and then spreads down the body and onto the limbs. And so in most people, that's the extent of the illness, and then they recover after a week or two. But in about 10% of people, there are complications. And the common complications are middle ear infections and pneumonia, so bacterial secondary infections, in other words. So the measles virus kind of plows the field, and then you get these severe infections following on. And then the more rare but more severe complications is encephalitis, which is brain inflammation, and that can cause death, as can severe pneumonias. So because of the severe complications, this is the reason why it's a public health concern, and why the World Health Organization in most countries are aiming to or have eliminated measles as an endemic illness.
How is it transmitted and what makes it so infectious?
Yeah, so it's transmitted via respiratory droplets. So you just really need to be in the same room as a person with measles for more than about 15 minutes or so. And you've got a pretty high chance of catching it if you're not immune yourself. There's a measure about the infectiousness of viruses that people will have learned about during the COVID pandemic called R0. And so R0 is the average number of secondary cases you'll get from one person infected. And people will recall for the COVID virus, it varied a bit over time, but it was somewhere around 3 or 4 at its peak. Whereas for measles has the highest known R0 of any human virus, and that's between 12 and 18.
That's the number of people that one person will probably pass it on to.
Exactly. So in an unvaccinated population, one person with measles on average will infect, so 15 others. And each of those 15 will then infect 15 others, and so on and so on. So pretty rapidly, the entire population of an area will have measles if they're not immune, which is why we vaccinate people. So if a high enough proportion of a population is vaccinated, then measles won't spread through that population. That's known as herd immunity. Mm-hmm. And for measles, that proportion's about 95%.
Right. And did Australia ever get towards herd immunity?
Yeah, so in 2014, the WHO officially certified Australia as having eliminated endemic measles. And what that means is, it doesn't mean there's 0 cases ever. It means we really only had imported cases from overseas that then kind of petered out and didn't result in local outbreaks because we had such high community levels of vaccination. And unfortunately, in Australia, as in the US and in many other countries, that's starting to change a little bit and be weakened by falling vaccination rates.
Why are vaccination rates falling, do you think?
I mean, it's a number of reasons, but the most important one is the undermining of public trust in the safety of the vaccine. And one of the largest contributors to that is a paper that was published around 20 years ago in The Lancet that linked measles vaccine to autism. So this paper claimed measles vaccine was a cause of autism in young children. It later turned out this paper was a fraud, as in it was fabricated or exaggerated data. But it took, 10 to 20 years before that was conclusively proven and accepted. And a huge amount of damage was done in that time. And a lot of people still believe that paper was true, or that they're aware that this paper existed, but not that it's actually subsequently been retracted by the authors as fraud.
To what extent do you think that society's attitudes towards vaccines were affected by the COVID-19 pandemic?
Yes, the COVID-19 pandemic affected vaccination rates in a couple of ways. One is just in logistical and practical ways, because it was harder for people to get out of the house and get to doctors or appointments to get vaccinations. But then secondly, there was a large increase in kind of conspiracy theories and public mistrust of science. So for both of those reasons, vaccination rates in Australia have been falling since about 2020 towards measles.
Should the average Australian be concerned about measles right now? I mean, why is it in focus right now?
It's in focus because there's been more cases in Australia this year so far than the entirety of last year. So there's been around 80 cases in Australia for the first quarter of this year, which is more than we had in all of last year. And most of these cases are imported cases, people that have caught it overseas or people that have come from overseas who are not vaccinated. However, quite a few of them are then secondary local cases where people who haven't been overseas have acquired measles from travellers. And that shouldn't be happening if our community has sufficient vaccination rates. Probably the reason it's in the news more so is that in the USA, the USA is having their biggest outbreak that they've had for many years. They've had hundreds of cases this year, more than 800 so far, and 3 deaths. And obviously people will have seen in the news there's a lot of noise at the moment in the United States about public mistrust of science, conspiracy theories, anti-vaccination sentiment, and so on. And that is really feeding this outbreak there.
Professor Joshua Davis is our guest today on Wellbeing. We're talking about measles. Let's get to the vaccination, Josh. The vaccine for measles, actually, they call it MMR, don't they, for measles, mumps, and rubella. Can you explain how a vaccine works?
Yeah, sure. It's in Australia, the vaccine we use is MMR, so it vaccinates you against mumps and rubella viruses at the same time as measles virus. And there are different ways that vaccine works. There's a lot of different vaccine technologies. Again, people will have heard a lot about during the COVID pandemic. The MMR vaccine is a very simple and old-fashioned vaccine technique, which is what's called a live attenuated virus. So they basically take an actual measles virus, manipulate it in the lab to weaken it, and then inject that virus into you. So basically the vaccine gives you a very mild case of the measles, but the virus is so weak that the majority of people get no symptoms at all. So they get infected with this virus, their body makes an immune response to the virus, just like they'd really had the measles. And then after that, they're immune to it, so they can make antibodies and so on against the virus.
Do we know what percentage of Australians are currently vaccinated against measles?
Yeah, I mean, it varies a lot by state and by even little pockets within cities. So, for example, on average, over 90% of Australians are vaccinated. I think it's around 94%. However, there are definitely little pockets of under-vaccination. For example, north coast areas of New South Wales, it's down below 80%. Some areas of even inner city, Sydney and Melbourne, are down below 80%. And this is really around these anti-vaccination kind of beliefs. And so that's really dangerous, because if an imported case or any case of measles gets into that population, you end up with a lot of cases and usually then inevitably a few deaths or severe illnesses.
If you're unsure about whether or not you've been vaccinated, and you mentioned that most people were since the late 50s, the early 60s, is there a way to tell whether you've got immunity?
Yeah, there's two ways you could find out. One is there's a thing called the Australian Immunisation Register, where there's a record of whether you've had vaccinations or not. And in fact, you can check that yourself online, or your GP can check that for you. The second way is by doing a blood test. So there's a blood test that can look for antibodies, and then we'll be able to tell you if you're immune to measles. It can't distinguish between whether it was from vaccination or from natural infection, but the blood test can tell you that.
Okay. And if you're not sure that you've been vaccinated or not, is it okay to go ahead and be vaccinated in any case?
Yeah, absolutely. It is. The only sort of reasons to not get vaccinated is if you have a suppressed immune system. So, for example, people are on medication for an autoimmune condition like rheumatoid arthritis or lupus or something like that, or chemotherapy for cancer. So if you're on medications that suppress your immune system, then it's not safe to use live virus vaccines like measles and like many others. So that's a very small, proportion of the population. For everyone else, it's safe to get measles vaccine. And if for some reason you haven't been vaccinated for measles, you can go along and get a vaccine from usually via your GP.
Now, you mentioned earlier that the symptoms are almost negligible. If people do get symptoms, what's the kind of worst feeling they're going to get? I mean, do they get a rash or anything like that?
You mean from the vaccine?
Yeah, the vaccine itself.
Yeah. So about 80% of people get either no symptoms at all or very mild symptoms, such as a sore arm for a day or two after the vaccine. About the other 20% can get a fever from the vaccine, and that usually happens about 7 to 10 days later. So a mild fever that lasts a day or two, and occasionally a very mild rash that goes along with that fever. That's more common in younger kids than adults when they get vaccinated, and it's more common with the first dose than with the second dose. So yeah, most people get nothing, maybe a mild sore arm. About 20% get a mild fever illness a week or two later that self-resolves.
Because most people had measles when they were younger or were vaccinated against it when they were younger, you don't see it appearing so much in older people, or you didn't, I guess, up until recently. But is it becoming more prevalent now amongst older people?
It's actually quite rare to see it in someone who was born before the 1960s, because they basically all got measles when they were kids. If anyone got measles in their school, they all got it, for example. So it's pretty uncommon for older people to get measles these days. It's generally children and young adults or people that have not been vaccinated that of those age groups.
Okay. How are measles outbreaks typically detected and managed here in Australia?
So measles is what's known as a notifiable disease. So in Australia, or it's actually state-based, it's the same in all states, but in New South Wales, there's a list of infectious illnesses that if a laboratory or a doctor diagnoses these, they're legally obliged to tell the local Department of Health. So measles is one of those. So whenever a case of measles is diagnosed, the local Department of Health is alerted, and they will then follow that case up. They'll contact trace, and if they find out that there are any non-immune contacts of the person with measles, if non-immune contacts can be vaccinated for measles, and if that's done within 72 hours, it's quite effective at stopping spread.
Wow.
Let's just say, you're living in a household and someone from your household has come back from overseas and they have measles, have been diagnosed with measles, and you realise that, a couple of people in the house are not vaccinated. If they are vaccinated promptly, like within 72 hours of contact, it has a good chance of preventing them from getting sick.
Okay. Now, you mentioned earlier that the international travel is a big culprit at the moment in bringing measles back into Australia. Is that the most likely source of measles in Australia these days?
Yeah, it is at the moment, and that's just because vaccination rates are much lower in some other countries than they are in Australia.
Are there specific regions or countries from which we're more likely to have measles brought back into Australia?
It's mostly been Southeast Asia, and that's primarily because Australians go to Southeast Asia a lot. But there have been outbreaks in Vietnam, Cambodia, and other Southeast Asian countries in the last few years. One thing I've kind of alluded to once or twice, but I just thought we should come back to avoid confusion now is how many doses of vaccine people need to be immune.
Yes.
So to be considered fully vaccinated, you need to have had 2 doses of the measles vaccine. A single dose is very effective, about 95% effective, but 2 doses is close to 100% effective. So the routine now, like for babies born in Australia, is they get the first dose of measles vaccine at 12 months of age and the second dose at 18 months of age. Mm-hmm. But if you were not born in Australia, or you were but were not vaccinated as according to the schedule, and you now need to get vaccinated, you should have 2 doses, not just a single dose, at least 8 weeks apart.
8 weeks apart. So you would give that advice to Australians travelling overseas regarding measles, that they should know their vaccination history, and then they'd need to start planning to have a measles vaccine at least probably 9 weeks before they travel, yes?
No, I mean, if they've had a single dose of vaccine and they just need a booster, like a second dose, as long as it's, at least a week before they travel, that's fine. The 8 weeks refers to the gap between 2 doses. So if they're completely unvaccinated, as you say, ideally, yes, they should have 2 doses at least 8 weeks apart before they travel. But that may not be practical. They may need to go in a week or 2 from now. So even a single dose is pretty good. 2 doses ideal, but 1 dose is better than no doses at all.
How accessible are the vaccines in rural Australia?
They're very widely accessible. For most people, they're free, funded by the state government, and all large, small, and quite small hospitals and health facilities have vaccine fridges with supply. They may need to order them in. So if you're in a remote area that doesn't have measles vaccine easily available, it can be ordered in within a day or 2.
In terms of the future, do you see any big concerns when it comes to measles and its treatment in the next 5 to 10 years, or we're pretty much on track? If we steer the current course, we'll be fine.
No, if we steer the current course, we're in trouble. So as in, if you kind of extrapolate the graphs of what's happening at the moment, is vaccination rates are dropping, the number of outbreaks is increasing, and that's all to do with what I said before, this anti-science movement and the undermining of public trust in vaccines, and the current US government being the kind of prime example. So if Australia were to kind of follow in their footsteps, then we're going to be in trouble.
Are there any ongoing campaigns or initiatives to boost public awareness?
Yeah, I mean, there are always periodic campaigns about this. There's none that I'm aware of specifically at the moment, but there probably should be, I think.
And in terms of research, are there any notable trends there, or is the vaccine sufficient for its purpose?
Yeah, we don't need to develop new technologies. The vaccine works really well and is very safe. So it's all about kind of human behavior, human psychology, public health, all of that kind of stuff. How do we get people vaccinated? It's not about how do we create a better vaccine or a new drug. We don't need those things. We just need people to have high rates of vaccination in the community. One thing I didn't say at the beginning, in case people, think this is a pretty trivial thing, is measles in the kind of before about 20 to 30 years ago was killing about 1 million people a year in the world, mainly young children, so children that are not well nourished are at higher risk. And that number has dropped dramatically as vaccines are rolled out around the world, but it's still tens of thousands of people die every year from measles in the world, usually not in rich countries like ours that have high vaccination rates, but, it could be.
What would you say to families who are unsure about vaccinating their children? Maybe they've heard somebody says something negative about vaccines, or you can't trust them or whatever. What's your advice to these families?
So I'd say, firstly, don't believe everything you read on the internet or on social media, or even that other people say to you. Check your sources, go and verify yourself, and if in doubt, go and speak to your GP, because they can just give you the facts, the scientific facts, not the political interpretations or opinions. And the bottom line is this particular vaccine has very well established safety and efficacy record. There's really no doubts about it in the mind of anyone who understands science.
If you've been vaccinated, is it possible to get measles? I mean, if you've been vaccinated twice.
It's possible, but incredibly unlikely. So I think I mentioned earlier, 2 doses are around 99% effective, which means, there's a very small chance, even if you're vaccinated, that you can catch it close to zero, but not zero. If generally speaking, if people are vaccinated against a virus like this, but they catch it anyway, they get a very mild case. I mean, this is a good example of how effective this vaccine is. We've talked about COVID quite a few times, and people will be aware the COVID vaccine is, the various COVID vaccines are fairly effective, but nowhere near 99%. You can still catch COVID even though you're vaccinated. It just decreases your chance of catching it. The flu vaccine, for example, same deal. It decreases your risk of catching the flu, but it's pretty common to still catch it even if you're vaccinated. If you do, you get a milder case. Whereas with measles is actually quite an unusual vaccine in that there's close to zero, not zero, but close to zero chance of catching it if you're vaccinated.
Great. People wondering about vaccines in general. Measles is one, of course, that's very important that we've been talking about. Is it related to shingles at all, or is it completely different?
No, it's a completely different thing. Shingles is caused by a virus from the herpes family called varicella zoster virus. And measles is a different family of viruses called morbilliviruses. So I guess the only thing they have in common is that they're viruses.
Sure, with unpleasant side effects.
Yes, in fact, okay. One thing I was going to mention is one of my earliest memories as a 3-year-old was having measles, and how sick and horrible I felt because I hadn't been vaccinated. At the time, I think my parents were told, oh, no, you shouldn't vaccinate him because I was born premature, which is all wrong, incorrect. It wasn't understood at the time. And, yeah, it was quite bad, and I wouldn't wish it on anyone.
So you've got your immunity from having it?
Exactly, yes.
In that case, that raises one other question. If you've had measles as a child and got that immunity, do you then need to have vaccinations for measles?
Yeah, generally the answer is yes, because in my own case, for example, the diagnosis was just based on a doctor came and said, oh yeah, that baby's got measles, but there's a lot of other viruses that can cause fever and rash in kids. So generally, you don't know, no one usually knows for sure that that's what they had unless they've had a blood test. So if there's a history of having had, my mum told me I had measles when I was a kid, that's not enough to be sure, and you should still be vaccinated.
Okay. Thank you for the information, and I think many people will find this helpful.
No worries.
Professor Joshua Davis, Senior Staff Specialist in Infectious Disease at Newcastle's John Hunter Hospital and Deputy Director of the Hunter Medical Research Institute's Infection Research Program. Thanks for listening. I'm Graham Wilson, and all of us at Wellbeing wish you well.